Welcome back to our channel. Today, we're diving into an essential yet often overlooked part of the human skull, the palatine bone. If you've ever wondered how this small bone plays a crucial role in your daily functions, stick around. You're in for a fascinating journey. Did you know that the palatine bone is not just a single bone, but a complex structure that contributes to the formation of 3 cavities in your head? That's right. It helps form the floor of the nasal cavity, the roof of the mouth, and even the floor of the orbit. Intrigued? Let's explore more. Key features and anatomical relations. The palatine bones are a pair of L-shaped bones found along the posterior aspects of the nasal and oral cavities. They are classified as irregular bones and contribute to the formation of the nasal cavities, bony hard palate, and the viscerocranium. Each palatine bone includes the following bony features: articulates with opposite palatine bone, ethmoid and sphenoid bones, maxilla, vomer, and inferior nasal concha. Arterial supply, greater palatine artery. Ossification. Ossification of each palatine bone occurs at one ossification center in its perpendicular plate, which appears in utero during the 3rd month, and also forms the horizontal plate and the pyramidal, orbital, and sphenoidal processes. Variations. In some individuals, the lesser palatine canal may be absent. A bony outgrowth may be present along the bony hard palate, known as a torus palatinus. Surface anatomy. Regarding surface anatomy, the horizontal plate of palatine bone can be palpated along the posterior 1/4 of the hard palate. Parts of palatine bone. 1. The horizontal plate horizontal part is the horizontal flat bony plate of the palatine bone. It is one of the 2 bony plates of the palatine bone, the other being the perpendicular vertical plate, and it is continuous. The horizontal plates of the palatine bones combine to form the posterior 1/4 of the bony hard palate, while the palatine processes of the maxilla combine to form its anterior 3/4. The bony hard palate contributes to the formation of both the floor of the nasal cavity and the roof of the oral cavity. 2. The orbital process is the expanded, cube-like, superior projection of the palatine bone. Articulates with the maxilla and ethmoid bone. Contributes to the formation of the floor of the orbit. 3. The perpendicular plate perpendicular part, vertical plate, or vertical part, is the vertical, flat, bony plate of the palatine bone. 4. The pyramidal process is the thick, pointed posterolateral projection of the palatine bone. Consists of the lesser palatine foramina. Provides an origin site for the medial pterygoid muscle. 5. The sphenoidal process is the thin posteromedial projection of the palatine bone. It extends from the posterosuperior end of the perpendicular plate of palatine bone and is located posterior to the orbital process. 6. The choni are a pair of large, oval openings found along the posterior aspect each nasal cavity. The margin of each chona is formed. The right and left choni are separated from each other by the posterior border of vomer. They allow for the communication between the nasal cavities and the nasopharynx. 7. The greater palatine foramen is a small, round, posterolaterally located opening on the bony hard palate. It forms the inferior opening of the greater palatine canal. Each greater palatine foramen is located anterior to the lesser palatine foramina and medial to a 3rd molar tooth. Along the junction between the horizontal plate of a palatine bone and a maxilla, the greater palatine foramen allows for the passage of the greater palatine artery, vein, and nerve. 8. The inferior orbital fissure, sphenomaxillary fissure, is a large cleft found along the floor of each orbit. It is located inferior to the optic canal and superior orbital fissure. The inferior orbital fissure allows for the passage of the zygomatic nerve and the infraorbital artery, vein, and nerve. 9. The lesser palatine foramina are the small posterolaterally located openings found on the inferior aspect of the bony hard palate. They are located on the inferior aspect of a palatine bone. Posterior to a greater palatine foramen, the lesser palatine foramina are the inferior openings of the lesser palatine canals and allow for the passage of the lesser palatine arteries, veins, and nerves. 10. The sphenopalatine foramen anterior ethmoidal canal is a small opening found along the junctions between the sphenoid bone and the palatine bone. The sphenopalatine foramen allows for the passage of the superior posterior nasal branches of the pterygopalatine ganglion, sphenopalatine ganglion, and the sphenopalatine vessels. Surfaces of palatine bone. 1. The anterior border anterior margin is the serrated margin found along the frontal aspect of the horizontal plate of palatine bone. It extends laterally from the palatine crest to the junction between the perpendicular and horizontal plates. 2. The anterior border anterior margin is the thin, irregular margin found along the frontal aspect of the perpendicular plate of palatine bone. 3. The maxillary surface lateral surface is the area found along the lateral aspect of the perpendicular plate of palatine bone. It is continuous infralaterally with the pyramidal process of palatine bone and consists of the greater palatine groove. 4. The nasal surface superior surface is the smooth, concave area found along the superior aspect of the horizontal plate of palatine bone. It is continuous supralaterally with the nasal surface of the perpendicular plate of palatine bone. 6. The orbital surface is the smooth, triangular area found along the supralateral aspect of the orbital process of palatine bone. It contributes to the formation of the floor of the orbit. 7. The palatine surface inferior surface is the rough area found along the inferior aspect of the horizontal plate of palatine bone. It is continuous posterolaterally with the pyramidal process and contributes to the formation of the bony hard palate. 8. The posterior border posterior margin is the thin, concave, non-articular margin found along the dorsal aspect of the horizontal plate of palatine bone. 9. The posterior border posterior margin is the thin, concave margin found along the dorsal aspect of the perpendicular plate of palatine bone. Landmarks. 1. The conchoid crest is the horizontal, centrally located ridge found along the nasal surface of the perpendicular plate of palatine bone. 2. The ethmoidal crest is the oblique, superiorly located ridge found along the nasal surface of the perpendicular plate of palatine bone. 3. The greater palatine groove, greater palatine sulcus, is the shallow, oblique, inferiorly located depression found along the maxillary surface of the perpendicular plate. This canal allows for the passage of the greater palatine nerve and vessels. 4. The nasal crest is the medially located ridge found along the nasal surface of the horizontal plate of palatine bone. The nasal crests of both the right and left palatine bones articulate with the inferior border of the vomer. 5. The sphenopalatine notch is the deep indentation found along the superior aspect of the palatine bone. This foramen allows for the passage of the superior posterior nasal branches of the pterygopalatine ganglion, sphenopalatine ganglion, and the sphenopalatine vessels. Sutures. 1. The median palatine suture is a fibrous joint that separates the bony hard palate into right and left halves. It is the collective term for two articulation sites, located between the horizontal plates of the right and left palatine bones. 2. The palatoethmoidal suture is a fibrous joint found along the medial bony wall of the orbit. It is the articulation site located between the orbital process of the palatine bone and the orbital plate of the ethmoid bone. 3. The palatomaxillary suture maxillopalatine suture is a fibrous joint found along both the lateral bony wall of the nasal cavity and the floor of the orbit. It is the articulation site located between the lateral aspect of the palatine bone and the posteromedial aspect of the maxilla. 4. The transverse palatine suture is a fibrous joint that separates the anterior 3/4 of the bony hard palate from its posterior 1/4. It is the articulation site located between the palatine processes of both the right and left maxillae and the horizontal plates of both the right and left palatine bones. Craniometrics. 1. The posterior nasal spine is the pointed, posteriorly projecting process found along the midline on the inferior aspect of the cranium. The posterior nasal spine provides an origin site for the musculus uvulae. Here are some interesting facts about the palatine bone. Did you know that it's one of the last bones to fully ossify in the human body? Fascinating, right? And that wraps up our deep dive into the palatine bone. We hope you enjoyed learning about this fascinating part of our anatomy. If you found this video helpful, please give it a thumbs up and share it with your friends. Don't forget to subscribe to our channel for more insightful content on human anatomy. And if you have any questions or topics you want us to cover, drop them in the comments below. Thanks for watching, and we'll see you in the next video.